Hello, and welcome to Hello Health's Administrative Training Part 1. Once logged in, you will be greeted with the overview page. The overview page will consist of today's visits, messages, pending tasks, and unfinished past visits. Let's take a look at today's visits. Today's visits will include the time of the appointment, duration, patient's name, and status. The status of the visit can be selected as checked in exam room, checked out, canceled, or no-show. The first three options will be for patients who are already in office. The cancellation will be for patients who have canceled an appointment or the appointment was canceled by a provider. If canceled by a patient, you will have the option to charge a patient a cancellation fee. The cancellation fee will be at the discretion of the practice. Moving over to messages, you will be able to see the first 5 messages in your inbox. This will include both read and unread messages. Any visits in the unfinished past visit section will be for visits that have been started in visit documentation but have not yet been closed out with an electronic signature. Now let's talk about scheduling appointments for patients. When you first open the scheduler, you will notice that at the top of the screen you have a couple of different options on what to choose. On the top left-hand side, you will have forward and backward arrows that will allow you to toggle between previous and future weeks for scheduling patients. When you're ready to go back to the current date and time, click on Now. It'll highlight the current date as well as indicate the time with a blue line on the schedule. Should there be multiple staff members working in the same schedule at the same time, the refresh button is here to allow you to see any updates that have been made in this scheduler. To the right of refresh, you will have the option of choosing how you view your schedule. You can view it in 1 hour, 2, 8, 12, or working hours. Working hours can be set in the administrative settings. Another way to personalize your schedule is to set it to be viewed in day, week, or monthly viewing. You can personalize these settings in your administrative section as well. The filters option will allow you to view your schedule by either type, status, patient, and categories of visits. You can select the options that you would like to see, and the ones unselected will be showed as grayed out in the actual schedule. You can choose to have your calendar and schedule shown in a list view. A list view will allow you to check in patients as well as print the list to carry with you or send as a PDF to send to email. We will now schedule an appointment for a patient. There are multiple ways of doing this from within the schedule viewer. You can click Add Appointment at the top right-hand side of the page. Alternately, you can click on the actual schedule by double-clicking, or you can simply click on the scheduler and drag to your desired time, which will then open up the event scheduler. From the Add Event box, you can select the event type. There are 3 different options. You have Visits, Block Time, and Out of Office. Block Time and Out of Office allow you to designate certain times in which scheduling should not take place. They will show up on your schedule as grayed out areas. It is still possible to schedule during these times, however, you will have to confirm that you want to schedule during a blocked out or out of office. Visit will allow you to start scheduling a visit for a patient. You will next be able to select the patient's name. If you are creating a new account, please select Create Account. The blue asterisk signs will show you what needs to be filled in when creating a patient account. The name, the last name, date of birth, and gender are all required information. The home phone number as well as the rest of the contact information can be added now or at a later time. Please note that at the bottom of the Create Account card, you will also have the option to add a credit card number. Should you need to add a guardian to the account or a parent, you can do that by selecting the Add Guardian on the bottom left-hand side of the Create Account page. You will be able to select the guardian type, add the information, as well as contact information for that particular guardian, select whether they will have patient account access, and whether they are also a patient of the practice. you are scheduling for an existing patient, go ahead and type in the patient's name in the Search for Patient panel. Once you have filled in the patient's name, you can go ahead and start selecting a time for the actual appointment. Selecting a time for the appointment can be done in multiple ways. You can select the Browse Schedule option, which will take you back to the original scheduler to choose a date and time that works for both you and the patient. The Get Next Availability button speaks for itself. Clicking on it will open up the doctor's next availability in his schedule. Should that availability not work, feel free to continue clicking Next until you find a time that works for the patient. Once the date and time has been scheduled for the patient's visit, you will now be able to select the duration. The duration of the visit is next to be set. However, the category of visit will actually predetermine how long each appointment will be. The duration of each appointment category can be set in the administrative settings, and we will show you how to do this in a later time. We are now ready to select the visit type. The visit type can be between an office visit, a house call, a video visit, an IM visit, and a phone visit. Office visits, video visits, and IM visits require no additional information. However, a house call will ask for a home address, and a phone visit will ask for a phone number. The reason for visit will also need to be completed. However, this can be automatically populated once the category of visit has been set up in the administrative settings. We'll discuss more on that a little bit later. Patient instructions can be typed into this free text box. You can also use the template feature, which can be found at the top right of the patient instructions box. Select the blue icon, choose a template, and it will automatically fill in the box. Templates can be found all over Hello Health and are great with time efficiency. Once all information has been added, feel free to provide a patient's email address. By providing a patient's email address, we will be able to communicate the creation of their appointment as well as an appointment reminder sent out 48 hours prior to the visit. If the patient does not have an email address on file or an email address to provide, simply click the box that says this patient does not have an email address. Once all information has been provided, you can now press Save. Now that the visit has been added to the calendar, you can go back and edit this. To edit, simply click on the visit that you just created, and it'll open up the patient card. The patient card will include basic patient information as well as visit information. At the top right-hand side, you will notice 3 horizontal lines. These horizontal lines act as a menu button. Clicking on them will open multiple options that you have from within the patient card. Going down all the way to the bottom, you will have an Edit Visit. Click on it. Now that you have the Edit Event box open, you can edit any information previously added. Once these changes have been made, you can notify the patient by email by selecting the Notify by Patient by Email button, or simply click Save. Another way to efficiently change the time and date of an appointment is to put your mouse over at the top right-hand side of the appointment block. A 4-point cursor will appear, and if you click down, you will be able to drag and drop this to another time in the calendar. A confirmation box will appear asking if you would really like to modify this event, and if you'd like to notify the patient by email. If you'd like to notify the patient by email, keep the box checked and click Yes. If you find that it is not necessary to notify the patient by email, uncheck the box and click Yes. Now that you have successfully created a visit, you will need to check the patients in. To check a patient in, simply click on the newly created appointment block, which will open up the patient card. On the bottom half of the patient card, you will see a clock previously shown to you on the overview page. By selecting this clock, you will have the option to check in, put in exam room, checked out, cancel, or no-show. Looking closer at the patient card, we will see that we have the name, date of birth, age, gender, contact information if provided, as well as their last and next visit scheduled. Towards the bottom, we will see the visit that they have for the day, the reason for the visit, and an option to go to the visit invoice. Taking a look at the 3 horizontal lines at the top of the patient card, we will have the option to edit demographics. Clicking on this will open up the demographic card, and you can edit any information which will be immediately reflected in the patient's EHR. Editing payment information will allow you to update a credit card on file or add a guarantor if necessary. Further down, you will have the option to access the patient's EHR, also send messages, add visits, create a new task or patient reminder, print the patient card, as well as subscribe a patient to a membership plan. These options will also be available when working as a staff member on behalf of a provider, with the only difference being that a staff member can schedule for multiple providers at the same time. Now let's look over at availabilities. Availabilities provide the ability for the provider to set the time for which patients can self-schedule. You have full control over this feature. To add a new availability to your schedule, simply click on the time and date that you wish for the availability to begin. It'll open up an Add Availability card, in which you can add the summary, availability period, recurrence, end date, category, type allowed, practice location, and whether it'll be visible to patients, as well as color coding each availability section. Let's take a look at each section separately. The summary is a free text field in which you can add what type of visit you would like added in each section. The availability period will be the time in which patients can schedule, as well as the starting date. Recurrence is used when you want to recreate this availability on multiple days of the week. An end date to this particular availability can be set as near as 1 week and as far as years, depending on how long you would like patients to be able to schedule during this time. Select the categories to restrict online booking for patients, as well as to inform staff members of the appointment categories you want booked. Leave blank if you do not want to restrict the type of categories booked. Type allowed refers to the type of visit a patient can schedule for, whether it be office, video, instant messaging, phone, or a house call. You can select each type of visit the patient can schedule, or simply select all if you'd like all options available. Practice location can be used, but only if you have multiple locations linked into your Hello Health account. Using the visible to patients prevents patients from booking during certain times, whether it be less than 1 hour before the appointment and more than 24 hours in advance. Selecting these options and times are strictly at the discretion of the office. Lastly, you have the option to color code your appointments. Simply select the color you'd like to use and click Save. Your new availability will appear on your calendar with the summary, the time, and the color coding that has been added. Just like the scheduling feature, you do have the option to edit the availability time and date by simply dragging and clicking from the top right-hand corner. If you wish to edit the availability created, simply double-click on the time, and it will ask you if you'd like to edit the event only or the complete recurrence. If you'd like to edit the entire recurrence, which is every day that has been created for that particular availability, click Recurrence. If you'd like to edit the time for that particular date only, click on Events. From here, you can edit the availability time to fit your needs. Click Save or Delete if you wish to no longer have this availability or recurrence on your schedule. Let's move on to tasks. Tasks can be created manually or automatically. Some examples of automatic tasks can be eFax, ERX refill requests, and delegate access requests. Manually created tasks are any tasks created by a provider and delegated to someone in the practice or vice versa. Looking at the task overview page, you will see that you can set task priority by urgent, high, normal, or low. You also have the option of adding a type, whether billing, colleague requests, patient reminder, patient requests, or even a phone message. You can also search by the status, whether active, completed, deleted, or all. The same thing goes for read, unread messages as well. Looking over at Display Tasks, you can look at tasks created from and to a specific date. Looking over at the Assign To section, it will automatically have your name in the box, but this can be easily changed simply by clicking on the X and typing in a staff member or provider in your office. About Patient allows you to select the patient in which the tasks are created for. Once you have all this information filled in, click Search. Any tasks meeting the criteria in the search will show up at the bottom of the page. It'll provide the title, priority, type, status, start date. Due date and completed will show only if necessary. Let's create a new task. There are many ways to create tasks from within Hello Health. We will do it in the Tasks section by clicking at the top right-hand side the Create Task button. This will open up a new task box where you can add the title of the task, add a scheduled date as well as a due date if necessary, change the priority, add a type, add a description, which is a free text field with the option of adding a template, which is easily recognizable by locating the blue box at the top right-hand side of the description field. If you're creating the task for yourself, simply leave the Assign To section as is. If you would like to add it to a staff member or a provider in office, click on the X at the right-hand side of the box and start typing in the name of the staff or provider. The task creation can be completed here by simply clicking Create. However, if you'd like to add a patient to this particular task, click in the Search for Patient and type in the patient's name. Select the patient from the drop-down menu. Should any attachments need to be added, click Add Attachment and upload them now. If the task has been completed, check the box and then click Create. With the task now created, you should be able to view it at the very top of your list. To the far right of the created task, you will have a pencil icon. Click on it. This icon will open up a few different options that can be completed on this particular task. You can mark it as read, edit and view it, postpone the task, complete it, delete it, or send a message on behalf of the task. Next, let's talk about messages. If you have used an email service before, such as Gmail, Hotmail, or Yahoo, this section works in the exact same way. The main and most important difference is that this is a secure messaging system between the provider and the patient or their staff. The main inbox is straightforward, including the from, conversation, date, and label if provided. To compose a message, click on Compose Message. This will open up a new message box where you can start creating your message. To successfully send a message, you will be required to fill in 3 different parts: the To section, subject, and message. The To section can be filled in by typing the first or last name of the patient, staff, or provider you wish to contact. Select the name from the drop-down when it appears. This will allow it to populate in the To section. You can add additional participants to the message by simply continuing to type in names in the To box. If at any point you would like to send a message to either all patients, all providers, or all staff members, simply start by typing in the word all. From here, you will have the option of choosing between patients, providers, or staff members, or simply click on all of them. Once we have your To section filled in, move on to subject. Fill that in, and then move on to message. The message section is a free text field with the option of adding templates. Once you have your To, subject, and message started, you will notice that the Save Draft at the top of the page will turn blue. This will mean that you are now ready to start saving drafts that are being typed. Please note that drafts are saved automatically every 15 seconds, and you will notice on the bottom right-hand side of the screen a message notification alerting you to the message being saved. Along with the automatic saving, you will also have the option of clicking the Save Draft at the top of the message as well as below next to the Send button. We understand that some messages may take longer than others, and because of this, you do have the option of charging the patient for the message. It's a quick process to do. Click on the box right next to the charge for this message, and you will notice that you'll have a $0 amount. If you click on the drop-down arrow, you'll be able to scroll down and select the amount you'd like to charge for each message. If you'd prefer not to charge for the message, just leave that box unchecked. You'll notice that below the charge for this message, you will also have the option of adding attachments. Here you can add attachments from your computer files or the patient's library files. Once everything has been filled in, you can now send the message. You will notice that once you send the message, a notification box will appear at the bottom of the right-hand side of the screen, alerting you to the message being sent. Once the message is sent, it'll bring you back to your inbox. Now that we're back in the inbox, let's take a closer look around. When you hover your mouse over a message in your inbox, you'll notice that under the From section, you'll have a little drop-down arrow. If you click on this drop-down arrow, you will have some options for each message. An important item to note is that all messages either sent or received within Hello Help cannot be deleted. However, with the first option in the drop-down menu, you can archive these messages. The archiving process is quick. It'll ask you if you'd like to archive the thread. Click Yes, and the message will be removed from your inbox and into the archive folder. Moving down, you will see that you also have the option to assign this message to a visit. Assigning a message to a visit is quick. You'll need to type in the patient's name, then select the visit that you would like to assign this message to. Then click Save. You will now be able to go into the actual patient's visit and find that message at the bottom of the visit documentation. Moving on, we can also save messages to a medical record, which will basically save the message as a custom event in the patient's visits. We will discuss custom events later on in visit documentation training. Next, you can save the message as an administrative note in the patient's EHR or link the thread to a patient. Linking a thread to a patient works well when parents or guardians are messaging on behalf of a child or a spouse messaging on behalf of their partner. You can also easily create tasks for messages received, as well as mark them as unread or move them to a new folder. Folders can easily be created by selecting Create a Folder, adding a name, and clicking Save. If we open up a message and look at the More Actions item at the top of the page, we will also notice that we have the option of printing this particular message. When the print box opens, at the bottom of the page, you will see Download PDF or Print. Just simply select the option that works best for you. Right above the message, you will have yet another More Actions option. This option will allow you to mark as unread or add a label. The labels are a color coding system that allow you to easily recognize each message from within the inbox. For example, in Dr. Troy's inbox, we have green for billing, yellow for Dr. Troy, and purple are refill requests. Going back to the mailbox, you'll see that the inbox has a number next to it, which is indicating that there are 4 messages that have yet to be read. Going down, we'll have our drafts box, which you can open and find any unsent drafts. Archived messages will still be able to have actions taken upon them, as well as unarchiving them, assigning them to visit or medical records, administrative notes, and so on. A great feature about Hello Health is that we do offer the option of using electronic faxes. Once your practice is created and finished training, we will provide you with an electronic fax number for you to distribute. This fax system is for incoming faxes only, and you will receive a generic system fax delivery message letting you know how many pages each fax contains. You can choose to open the PDF in the PDF browser. From here you can save it, show file info, click on the pencil on the right hand side, and you can also mark it as reviewed, sign the document, create a task, send it in a message, view it in browser, or download it. If you X out of the PDF browser and move over to the pencil on the right hand side of the message box, you'll be able to also open the document in browser, download the document, add the file to a library, or create a new task. System and Direct will contain any messages created automatically by the system and sent to patients, as well as direct messages. We will discuss direct messages later on in another training session. Your Send folder will show you any messages sent by you or by your system to patients providers, or staff members. Moving down to People, Panel will allow you to search any messages sent within your patient panel, and Team will show you any messages sent within team members, either staff or providers linked to you in Hello Health. And finally, within the message system, we have Preferences. We here at Hello Health understand that immediate response times to messages are nearly impossible. It's because of this we offer the option of turning on an auto-reply message. These are to be sent out to patients immediately after receiving their messages. These messages can communicate many subjects, such as vacation and holiday times, emergency information, as well as just to let them know that you will respond within 24 to 48 business hours. As mentioned before, you can also add templates to your messages, as well as create a personalized signature. When you're ready to start searching for patients, you can access the panel. In this area, you will be able to search patients, contacts, as well as inactive patients. To begin your search, enter a name, phone number, or Hello Health ID. The Hello Health ID can be found in the ID validation on the patient's card. Clicking on the first drop-down menu will allow you to select Patients, Contacts, Include Inactive, or Include Picture. You have the ability of searching for more or multiple combinations within the search panel. For more search options, click on Advanced Settings in the top right-hand corner of the patient panel. Advanced Search provides the ability to search for additional criteria from within Hello Health. Combinations are practically endless, and each new search can be saved as a query for future reference. Other options available to you once the search has been completed and results have been found are to create a new task with search results, create patient reminders, send a mass message to the group, or export the list information. Advanced search queries can also be used to create clinical decision reminders, as well as when setting up patient education. Taking a look now at the admin section and going into public profile, this information is what will be shared with your patients when they access their patient portal. All of this information can be edited in the Edit My Profile section. It will be your responsibility to fill in the Basics section. However, Hello Health will take care of any practice locations that need to be added, as well as adding terms and conditions to your account. If provided, Professional will already have your NPI number, DEA number, as well as the license number. The Services Offered section is a free text field for you to fill in as needed, as well as background and my philosophy. Passwords can be changed and will require your current password as well as a new password containing 6 to 12 digits, alphanumeric only. You also have the option of adding multiple hospital affiliations. You can also set your scheduling viewer to default to daily, weekly, or monthly. Scheduling intervals can be predetermined as well. Moving on to settings, we will be able to set our schedule. You can set your working hours to be the hours that your office will be open, and this will be reflected in your scheduler. Scheduling view, as well as scheduling interval, can also be sent to your personalized needs. Setting appointment categories is very simple. First, click on Add New. You'll be able to type in the name of the appointment category here. Fill in the predetermined duration time by using the up and down arrows in the hours and minutes field, or simply by typing them in. Select whether the visit will be an office, video, house, phone, or IM visit, and then choose whether this visit will be available for patients to schedule online. This is done by checking off the Visible to Patients box. Color coding your appointment categories are completely up to you. Add any additional notes to the Notes section and then click Add. Once you have set your scheduling information, be sure to click Save so that nothing is lost. Moving down to Visit Note Sharing, these are the default settings for documentation sharing. Selected sections will be shared with your patients once the visit is finished. You can override these settings on an individual basis within the visit documentation. Onto billing and procedures, insurance payers can be added by using the Manage Payers list. For procedures, add the procedures that you use most frequently. Indicate which procedures should be added by default to superbills. To manage this, simply select Add New. In the Procedure section, type in the procedure name or procedure code. Select the category, the visit type, add the price, as well as additional modifiers, and then in the Add to Superbill, check whether it'll be defaulted or not. After creation, these can be edited by hovering your mouse over the selection and clicking on the pencil icon. You can then edit or delete the information. Clinical decision reminders are a helpful tool and can be enabled below by selecting the appropriate ones for the practice, taking into account your workflows and patient population. For enabled reminders, a notification displays at the top of the screen when an element in the patient record triggers a rule. To create a clinical decision reminder, click on Add New. Type in the title as well as description of the reminder, color coding, a related query which can be found and created in the advanced search settings, select Enabled, and then type in the category, type, any references, developer, funding sources, or revision. Once these have been added, click Save. Again, you will be able to find these clinical decision reminders at the top of the patient's screen in their EHR. In the Supply section, you can create custom items for invoicing, whether it be medication, durables, tests, or immunizations. Simply add the custom item, select the category, add a price, and then click the plus sign. Once created, they can be reused in future invoices. Hello Health uses Medline Plus for their patient education. However, we do allow you the opportunity to add your own. Simply click Add New, type in the title of the education, the URL, a related query, which can be found in the Advanced Search section, a type, the source of the education, and then a brief description in the right-hand box. This information can be saved and shared with patients for future use. For ERX, you do have the option of selecting an out-of-office feature. This allows another provider in the practice to receive refill requests on behalf of you. Just simply enable or disable this feature as needed. For labs, set your default billing to client billing, patient billing, or third-party billing. The lab company defaulted, and then whether the information will automatically be shared with the patient once they are reviewed, and then whether you want the requisition to be printed when ordering. Next, we have My Templates. This section allows you to edit, create, or delete any templates within Hello Health. The bold black lettering indicates which section each template is for, and the blue lettering is for each individual template. To create a new template, click on Add New. This will open up the template creation box. From here you can add, remove, or edit templates. To add, click on the plus sign located to the right of the word Templates. This preview box will allow you to add a name to your templates as well as enter the template in the free text field. If you have templates already created, just copy and paste into this box. Once the template is ready, click Save. To remove a template, select it from the box on the left-hand side and then click the minus button at the top near the word Template. It will ask you to confirm the removal before it is completed. If you have a template previously created but need to edit it, select it from the left-hand side and then click on the pencil icon located at the top right-hand side of the preview box. This will open up the template and allow you to make any changes. Once the changes have been made, press Save. For the membership plans, we will go ahead and create those for you with the option of office visits as well as emails at the prices of $69 and $89 for an individual and family plan. Global visit cancellation fees can be set up, as well as a cancellation note and cancellation time. Cancellation fee, note, and time are all set up to the discretion of the practice. Invoices can be searched by a filter list of paid, due cash, pending, or problem. Types can be visit, lab request, message, membership fee, or custom, and you can also search by the start and end date of an invoice. Once an invoice has been searched, you will be able to see who it was billed to as well as the invoice number. The date will be the creation of the invoice as well as the payment date. If it's pending, it means it has not been paid yet. For the payment, if it has not been paid, it will stay in pending. If it has been paid, it'll show as paid by cash, card, or check, or if there's a billing problem, it'll show up as problem. And then you have the type and total, which will all vary. You can also create a new invoice from this screen. To do this, simply type in the patient's name and then choose whether to add a custom item or select from your supplies list. Once you have selected the items for the invoice, you can add additional notes and then either click to pay cash or card or save it to be invoiced at a later date. Superbills can also be exported from the admin section, and we will go over that a little bit more during visit documentation training. This now concludes your administrative training module 1. I hope that you will be back to join us for the rest of the modules in this series. Thank you.